Amin and myself, Deepak Joseph, we are going to be showing you 3 blocks here. Fascia iliaca block, femoral nerve block, and lateral cutaneous nerve of the thigh. Okay? All are relatively easy superficial nerve blocks. What we are going to attempt to try and show you is not just to look for the nerves, but to look for other landmarks which makes it easy for you to approach it. Okay, so let's start. Let me introduce, and he's helping us today. Thank you, Paul. Okay, so let's start off by looking at a little bit of jelly. And as I go along, my first question to you is, where is the femoral nerve? Is it above or below the fascia iliaca? Below the fascia iliaca? Everybody agrees below the fascia iliaca? Unity? In agreement? You're not so sure? It doesn't matter, it's below the fascia iliaca, okay? Okay, so let's look at this picture here quickly. Okay, what does it show? It shows a big muscle here. Next to the femoral artery, what's that muscle? It is the Iliacus muscle. Okay, so these are the 2 points. If you know these 2 points, you are practically okay. Let's start scanning the patient here. And when you're scanning, I don't know whether to keep it like this, like that. I'm not so sure. What I'll do is I'll just let the probe just flop into the femoral groove. Okay, femoral groove is a very common landmark. You just drop it in there. Okay, and then you're going to scan laterally following the groove. Okay, so as I drop it in there, what appears on the screen? Okay, femoral artery is pretty clear. Yeah. So what I'll do is, because what is this 2 branches of femoral artery, I'll scan it a little further up north so that it's 1 branch. Femoral vein on the side which is collapsible. Okay, and you have a triangular area medial to it. Okay. Now, I'm not even paying attention to it. I'm not looking at it. What am I interested? I go a bit more laterally and I look at this. What is this? That's the iliacus muscle. Great. Okay, so I'm interested in that bright line over the iliacus. What is that? Fascia iliaca. I'm also interested in that other bright line which actually goes above the artery. What's that line? Fascia lata. Okay. So I've not talked about femoral nerve so far, but we have agreed that femoral nerve lies below the fascia iliaca. Okay, so let's follow the fascia iliaca. You see that area there? That bright area there is the fascia, is the femoral nerve. This is very typical. In real life, you may not necessarily find the femoral nerve as a nice round structure. It can be in a couple of branches, it can be thin and flat. Okay, very important to find the fascia iliaca and follow it down. And remember, when you put your needle, it should be below the fascia iliaca to get an effective femoral nerve block. So if you go and put it there, oh, there's a large area of triangle area, if I'll put it there, it may not work. Okay, it should be below the fascia iliaca. Point number 1, femoral nerve block. Let's go laterally. We agreed that this is pretty straightforward. It is a clear muscle here. What is this muscle? It's the iliacus muscle. There's no doubt about it. Okay, I'm going to scan a little bit further from the iliacus muscle, and then the iliacus is finished, and there's a new muscle appearing. What's that muscle? It is just below the anterior superior iliac spine. It originates at the anterior superior iliac spine. It's a Sartorius. Okay, clear? Sartorius, clear muscle, no doubt about that. Okay, let's go laterally. And when you go further from there, you actually see a space between the tensor fasciae lata muscle on the side and a triangular sort of space, subcutaneous, at the depth of about half a centimeter, and a bubbly structure in the middle of that. And what is that? That is the lateral cutaneous nerve of the thigh. Okay? It is a small nerve, difficult to see. If that is 1 centimeter, that is about 2 millimeters. It's a very tiny nerve. Yes? So, it's important to look for the landmarks. What is the important landmark? Is the triangular space between tensor fasciae lata and the Sartorius muscle, and you will find it just there as a little round bubbly structure. Okay? Let's come back here. Okay? Once again, we agree it's easy to find the femoral artery. We agreed that it's easy to find the muscle next to it. And what is that muscle? If I were to put a needle below the fascia, which is covering the iliacus, and put 40 mL there, what would that be? Of local anesthetic there? It would be a fascia iliaca block. Except that it's infra-inguinal, because it's below the inguinal ligament, isn't it? Now what I want to do is, I want to do a supra-inguinal ligament fascia iliaca block. So let's keep the muscle right in picture. Easily demonstrated, it is not. And you can see the fascia, you can see the muscle. and I'm going to turn it now by 90 degrees. Okay? Now that is the fascia again, that's the muscle. Yeah? Agreed? And I'm going to advance it higher up into the pelvis. And as I advance into the pelvis, what is the structure that I'm seeing? It's not very clearly. I think I just slipped up a bit. Here you go. Let's do again. There's a muscle, there's a muscle. At 90 degrees. And let's go into the pelvis. Okay. What is that sharp? I just need to increase the depth a bit. Okay. What is that mountain that's appearing there? No, that is the anterior superior iliac spine. Okay. So now I know that from the anterior superior iliac spine, the inguinal ligaments extends to the pubic tubercle. So if I put a block above the anterior superior iliac spine, there or further inside, it would be a suprainguinal fascia iliac block. So what I'm doing now, I'm going to put my needle, bring it up into that space, local anesthetic, expands the space, I put a needle, advance the needle a bit further, 30 to 40 mils of local anesthetic, suprainguinal fascia iliaca block. Okay? So, in summary, we've just shown you femoral nerve block, lateral cutaneous nerve block, fascia iliaca infrainguinal, and fascia iliacus suprainguinal. Now it's time for you to demonstrate it. Go ahead. We'll divide into two groups. Some of them can go here, some of them can stay here. As I said, the first thing, well done for just dropping it into the groove. Great job. Okay. Okay. So you can see that it's dividing into two. Maybe that's fine. If you want to make it one, you have to push it, get it further up, like that. Yeah. But even if it doesn't, it's okay. I don't mind. What is important is for you to locate what are interesting for us. What is interesting for us? I'm interested in that iliacus muscle. Let me just make it light, slightly more superficial. I'm interested in that muscle. I am interested in the fascia covering that muscle. And what is that fascia? What is that covering the muscle? Fascia iliaca. Okay. And let us change the inclination of our probe to just get the best reflection. Okay. To just get it clear, nice and clear. This is not so clear because you're just a little bit below. There you go. Yeah. Clear. Okay. Fascia iliaca. Okay. Muscle, fascia iliaca. Great. And you're going to expect the femoral nerve here. By sometimes adjusting, there you go. Your femoral nerve begins to appear. Yes, that's your femoral nerve. Can you see how it is enclosed within the fascia iliaca? So if you were to actually just put it here, it would not work because fascia iliaca travels over the nerve and between the artery. Okay? Yeah, is that clear? Okay, so that's your femoral nerve block. That is the most important thing. Femoral nerve block, put the needle, bring it below the fascia iliaca. Okay, let's travel laterally. And you can see this muscle very clearly again. Okay, iliacus. And not just that, you can also see the bright line covering the fascia, covering the iliacus, which is the fascia iliaca. And you can always put the needle from there down below that and give a large volume of local anesthetic. That would be an infrainguinal approach of a fascia iliaca block. Very straightforward. Yeah. Now let's go travel laterally. And you see the next muscle appearing. And what is that muscle? Sartorius. Let's keep going laterally again. Gently. Beautiful, beautiful, beautiful. Little bit more. And stop there. You see the triangle. And you see the nerve inside. Very clear? Nice demonstration. If you want to just tilt up and down, sometimes you can make the nerve appear as bright as it can. I think that is probably as bright as it gets. Okay, so that's your nerve. Okay, now let's come back. Now let's come back down the road to once again the artery and the iliacus muscle. Show me the iliacus muscle. Let's get the iliacus muscle in the middle of the groove. Let's bring it. That's your muscle. Great. Okay, turn the probe 90 degrees. Yes. Okay, take your little finger and put it on the anterior superior left hand. Yes. Okay, bring your probe closer towards it. Okay, you're going to just bring it closer towards it, anterior superior iliac spine. Okay, so that's your anterior superior iliac spine. That is your muscle. That's the fascia. Okay, now let's advance into the pelvis. Okay, beautiful, beautiful. There you go. Iliacus muscle coming from inside the pelvis and the fascia covering it If your needle is above that anterior superior iliac spine, inside here, you will put some local anesthetic, expand the space, insert your needle a bit more, give 30 to 40 mils, a successful suprainguinal approach to fascia iliaca. Next. Okay, good, very good. I like that. You just followed the groove. Great. Okay. Okay, let's advance it slightly higher to make that two vessels one if possible. Great, great job. Great job. Okay, like I said, you can't see the femoral nerve very well, but that is not the message of mine. It's often you can't see it very well. And by manipulating the probe, you should always know where to look for it. And it's going to be below? Correct. Okay, what is that one there? Yes? Yeah? And let's just tilt the probe and see if you can find your nerve. Can you find the nerve? The right structure appearing. Yes? Yes. Right structure. There you go. Not the greatest image, but very, very acceptable. You absolutely know what it is because you know where to look for it. Okay? Let's focus on that muscle and stop there. And what is this? Correct. Correct. And what is this one here? How do you know it's fascia lata? Because it goes above the artery. Yes, it does not go down here. It goes superficial fascia of the leg. Okay, okay. Let's go laterally. And what is that muscle? Correct. Gently go back. Now we are looking in the top 1/4, beyond it. Beautiful. The triangular structure with the nerve in the middle. Yes. Lateral cutaneous nerve, the thigh. Yes. Beautiful. Let's go back and find the Iliacus muscle. Keep the iliacus muscle in the middle of the screen. Good. 90-degree rotation. Great stuff. Okay. Okay. So you have the muscle, you have the fascia, except you can't see the anterior superior iliac spine. So just get it a little bit find where the anterior, get it closer to anterior superior iliac spine. Maybe just bend it across a little bit. Okay. Very good. Okay. Anterior superior iliac spine. Yes? Yes? Let's go up into the pelvis. Beautiful. Beautiful, beautiful. Can you see the bow tie appearance? Yes. The hourglass figure or the bow tie appearance. Okay. Needle goes in. As long as you're above that, there, you're going to be all right. Yes? Yes. Yeah. Great. Easy. Easy, easy. No worries. Nice. Well done. Okay, great. Perfect. Yes, that's what you're interested in. Yes, very good. Good stuff. Good stuff. So that's your artery. You're happy with that? Yes. Okay. So let's just see if we can find. At this point, what I want to do is gently tilt the probe above and below until you delineate the fascia more clearly. Okay. Let's go a bit more. There you are. Okay. Beautiful image. Okay. Can you see the muscle beautifully? Yes. So if you put your needle here and give a large volume of local anesthetic, what would that be? Infrainguinal. Yes. Now let's also do the femoral. Let's go femoral. Yes. I can't see it very well, but so what? I know where it is, isn't it? I know where it is. I'm interested in the fascia, so I shall do a little bit of tilting, and it appears. You see the nerve just there below the fascia. It's important to remember this. So if you were to put the local anesthetic between the fascia in plane,
and then you are going
below the fascia iliaca. Good. All the way till there. As you approach closer towards it, if it is not clearly visible, either use nerve stimulator or just inject 1 ml at a time to open the space up, and the nerve will become more and more delineated. Okay? You don't want to go without seeing it. Okay? So otherwise you will probably end up stabbing the nerve. You don't want to do that. You approach in plane and you gently distend the space until it becomes clearer. Okay, let's go lateral. Okay, so that muscle is ending and next muscle is beginning. What's that? Next muscle? Sartorius. And why is the Sartorius so small here? He showed a bigger muscle because it's just literally just originating from the anterior superior iliac spine. So if you think, oh, I don't know if that is the case or not. Yeah. So what you do is as you come from the lateral aspect, let's get the muscle, iliacus, good?
Okay.
Yeah, and if you think the muscle is too small, it's usually because it's too high up. Okay, because it's just originating, that's it, yeah? So that's your Sartorius, great, okay?
So go below.
Not go below, go lateral.
Lateral.
And then what happens? A triangular structure with the nerve in the middle of it appears. That is the lateral cutaneous. Can you see that? Beautifully done. Beautifully done. Superficial, super superficial.
Yeah.
Okay?
So here.
Okay? That's your nerve.
Yes.
Can you see the triangular space between the muscles? There you are. Fascia layer comes through, splits, encloses the nerve, comes together, goes out. Okay? All right. Let's go back and find. Let me increase the depth again for you. Okay, that's pretty good, I think. Okay, let's find the artery again. Simple. Muscle lying next to it is, what's that muscle line? Iliacus. Get the iliacus in the middle. Yes. Tilt the probe to get the fascia. Beautiful. Okay. Now 90 degrees. Boldly, keeping an eye. So that is still continues with the muscle. That continues with the fascia, and you are seeing something there as well. Yes. The moment you see and tilt it, and now what you do is you go into the pelvis. Let's go into the pelvis. There you go. Okay, anterior superior iliac spine. That's the iliac bone. Fascia covering the iliac muscle is the fascia iliaca. Not from the top. You will inject from the bottom. You will be holding the probe with your left hand. Easy, easy. Yes, as long as your needle is above, further there, you're all right. There you go. Plenty of space. Plenty of space.
Okay. So from below.
Yes.
Okay.
Okay, all these three nerves, lateral cutaneous nerve of the thigh, the obturator nerve, and the femoral nerve, are all below the fascia iliaca. From inside the pelvis, they're coming out and following below all the way through. That's the reason why you are hoping that if I deposit a large volume below this fascia, it will spread and block all these nerves.
I can use it as anesthesia as well.
Beg your pardon?
I can use 0.5, 0.7 for anesthesia.
Just calculate the concentration of the milligrams per kg body weight, dilute it accordingly.
Okay.
Isn't it? In fact, you usually have plenty.
Yeah.
Yeah. You can dilute it to 0.325 or 0.25% because you just want sensory analgesia. Great. You drop it literally. Yeah. Just literally into the groove. Nice. Hold the thing like that. Nice one. Okay. Great. Arteries. Let's just go a little bit higher up. Nice one. Okay. Now this is pretty good picture. So you're going to tilt it up and down till you see the femoral nerve. Okay. As you see, it's flattened. It's not so clear, but that's your nerve. Just there. Important thing is to recognize that that line that is going above is fascia lata. That one that is going down is the fascia iliaca because that is sticking to the iliacus muscle. Yes. Now let's travel laterally. Okay, so here you have a beautiful picture with fascia lata coming like this, fascia iliaca just below it. If you put your needle below fascia iliaca and give a large volume here, it would be the infrainguinal fascia iliaca plain block. Great. Okay, let's travel lateral again. Yeah, go further lateral. Gently keep going down. Okay, so in fact you've gone. Okay, so let's come here. You can see that if you look here, the muscle is over and the next muscle is starting there. Okay. Okay, and this is what is this muscle here? Yeah, see, if I go up, this becomes smaller and smaller. Why is it becoming smaller and smaller? Because you're approaching the anterior superior iliac spine from where it's just originating. So if you come down, it becomes bigger. Yes, so that is the Sartorius. Yes, let's go lateral. Okay, yes, okay. What are you seeing here? Can you see? Okay, can you see the triangular space? Where is the triangular space expected? Just lateral to the Sartorius within the first 1 centimeter. Okay, so let's do this well. Okay, there you go. Let's do this lateral, and that's your triangular space. Okay, and that is your nerve. Okay, sometimes it's better demonstrated in one way as compared to the other, and that's your triangular space. That's your nerve in there. Tiny bubbles. Can you see tiny bubble-like structure? Yes, that's your nerve.
5cc.
5 cc, 5 to 10 cc, 5 cc will do. Okay, now let's go back. Yes, and let's see the iliacus. Yes, iliacus, great. You see the iliacus. Now go 90 degrees to iliacus. Yes, good, good. Keep turning 90 degrees. Pretty good. Okay, so you know that that is a muscle. You know that's a fascia. Okay, you just need to find the anterior superior iliac spine. Put your left hand on the anterior superior iliac spine. Yes, and bring it close to it. Keep it, bring it close to it. Okay, so you see that there? Anterior superior iliac spine. The muscle. Yeah? Advance into the pelvis. Yeah, stop. That's it. So now is a great place. Anterior superior iliac spine is in picture. The muscle is in picture. Your knee will go in plane, below the fascia, iliaca, into the pelvis, and there you go. That's your block. Suprainguinal approach to fascia iliaca plane.